The endoscopic sheath of the little LOTTA Ventriculoscope is introduced into the third ventricle via the foramen of Monro under vision through the 0-degree diagnostic scope. The further steps of the surgery are performed with the little LOTTA Ventriculoscope. The floor of the third ventricle is perforated with the aid of the DEG forceps. Then the perforation is enlarged by inflating the balloon of the 3 French Fogarty balloon catheter. The balloon is pre-filled with saline to avoid the pop-up phenomenon and to allow slow, constant enlargement of the balloon. Multiple inflations are necessary to open the floor, as well as the underlying Liljeqvist membrane. The size of the fenestration is highly variable and depends on the size of the floor of the third ventricle. Usually we want to achieve a ventriculostomy size of about 4 to 6 millimeters. It's very important that any arachnoid membranes in the prepontine cistern are open as well, if necessary to enable good prepontine CSF flow. Finally, the prepontine cistern is inspected with the aid of the 30-degree diagnostic scope to make sure that the prepontine subarachnoid space is open. The endoscope is carefully removed from the third ventricle and from the lateral ventricle. The cortical puncture channel is inspected to reveal any active bleeding.